Well, greetings again. Dr. Bill Wyatt here with the American Orthodontic Society. And if you need help and you want to learn orthodontics, you can certainly go to the American Orthodontic Society. We have our headquarters now in Grapevine, Texas, which doesn't sound too big, but we're just within about 5 minutes of the international airport, and you can fly into Grapevine from anywhere in the world, really, and get picked up. And we have several hotels right close to our headquarters, and they will pick you up at the airport and take you back. And it's very convenient, so I hope you'll take advantage of that and get our new headquarters and take care of it. So thank you for tuning in. I'm going to just talk to you a little bit about the nature's guidance in orthodontic by serial extractions. And this thing has come up over the years, where people say, well, I'm a non-extraction person, and somebody says, well, I take out teeth. And way back years ago, they didn't ever take out teeth. When I had my teeth done, the labiolingual, that they couldn't do anything with it if they did take them out. So they said, this God has given you these 32 teeth, and you'll have to keep them. But they took the wisdom teeth out. They had to get them out in a lot of cases like that. So anyway, I want to show you one here where we took teeth out, and it made the face look much, much better than if you had kept the teeth. You could put anybody's teeth in there if you want to. They push out, and the teeth are too protrusive out here, and it doesn't look good. I had a dentist one time that she got hung up on this non-extraction completely, and had a patient, and he sat over there and said, we don't want to take any teeth out. So I straightened the teeth out and set them in, and put them all in there, and I had the parents and the dentist come in and look at it. They didn't like it at all, and so I took her back to the dentist, and he said, you're right, get some teeth out. So we took the teeth out and brought the face back normal. Now this is something we're in America, and we're mixed up. You can't imagine different types of genes that we've got in our body. Now I worked in Africa for about 3 years, and I went to a village one time. It wasn't a village, it was a lot of people there, and we had a school, and I didn't see a single person there with an orthodontic problem. None of them were crowded. They all married within that group like that, and everybody had protrusive, full faces, and none of them had a problem. But you take those same people, move them out and around in the world, and you have one with a large tooth marries somebody with a small facial structure, and if the child comes out and has the skin that is kind of like the one with the big teeth, you can look in, the teeth come from the same ectodermal layer that the skin comes from, and if they've got a skin from somebody that has large teeth and they have the Caucasian or small facial structure, they're going to be crowded as all get out. And that's just a fact of life. So let's get started on this case, and I'll try to show you what we did here. We have a young lady here's coming in, and these are just some pictures of her growing up, and that's the final picture of her. But now here's the way her teeth came in, and now I'm going to run through. And she had them crowned or put some facial covering on the teeth after she got through, which I wish she hadn't have done that. I'm going to get over here to some x-rays in a minute and show. We took teeth out on this young lady, and you do it so that you can you can figure out the size of the facial structure. Now, always, if you're talking to somebody, look at their family and let them decide, I want the facial structure that's back a little bit, or if they come from family that's very full, maybe they want their teeth out there, that's fine. Won't be any problem for you to do that. Now, this was 1972, and we've done this through this, and it's still the same thing happens. And here we did the slicing technique. We cut this off, and the cuspid's got to come in there. We don't have room to get these other teeth in here like we would like for them to be, so we extracted or took some bicuspids out on this case, and now this is the finished product, and this is a second bi. The first bis are gone here, and the cuspid, and these are the other teeth. Now, we'll look at 1972. So we took the deciduous tooth out. We went ahead and took the permanent tooth and the deciduous tooth and this little piece of tooth right here out. And now this is the second bicuspid, and this is the 6-year molar, and this is the second molar, and the wisdom teeth have some room to come in, and I don't know whether we got them in or not right here. I don't think we got any pictures back there. But here's the case where we did serial extraction on the case, and that is well, we do. We have the wisdom teeth are in there. See, these are 6-year molar, second molar, third molar. So we straightened this back in the back, and so now we have a wisdom tooth that has room to come in the mouth, and there are far better chewing than the other. Now let's look at the x-rays. Time you get this lateral in here, you've got to, it's going to take about that much space, and then you can look over here, you got this much, and here's what you got to stick in there. So this is kind of like an ice cream cone now, so this is not going to be that crowded when it gets down here. It goes down and gets bigger as it comes down like that. But we would not have room for this cuspid coming in here, see, coming up here. So we, in this particular case, we took the first bis out. Now here we did the slicing technique, and we had this coming in, and we sliced that deciduous cuspid off, and now we don't have to get this, this, and this in this gap right there. And it's just not room enough for it to do that. So we come in and see how crowded this is right here. And so we're going to take this out, and we're going to let these teeth drip in, and she's got wisdom teeth, and there's another thing that helped us. We can save the wisdom tooth if you've got, give it just a little bit more room and that tooth came in. So let's say we extract those. And now this is a few years later. This is coming in, and this tooth will hit in here and come on up. These have drifted forward in this area, and we look like we got our wisdom teeth in the case. Now this is kind of using nature to do this. Now I had nothing in there to guide or appliances or anything. We just did the serial extraction, and these teeth came in that form right there. And that's just letting nature do this. This is a natural orthodontic procedure. Now this is 7. Now we wait longer, and the wisdom teeth, I think, have come in. Let me see if okay, here the wisdom teeth are just about in on this side, and we have a Panorex, I think that's 80. We just had this young lady back again, the overbite, overjet, everything, and this happened without doing one bit of real orthodontic braces or anything like that on this case. Now, there she came back, and this is 12 of 90. And she's, I don't know how old it is, but anyway, these teeth are all in there. She has the wisdom teeth. If we had left this right here, we would probably have to remove the wisdom teeth here. She got these teeth facings on them. I don't like those facings, but anyway, they put them on there. Now, you can look at it with a cephalometric picture. Here's the way she looked and started. And she went here and here, and this is the finished product here, and this is 12 of 90, I believe. And we've just several years has passed now. You couldn't get a better profile. Look at it from the front. And she developed into a very attractive young lady. Now this can happen. I didn't touch it with anything. We just let nature bring these teeth in and kind of eliminate some teeth on the job coming in. So I don't care whether you extract or not extract, it doesn't matter. But there are cases that have really large teeth, and it's better that you get them out. It would be ridiculous. So let the people you're working on decide whether they want to have them extracted or not extracted, if it's somebody right on the fence to do that. I thank you for watching today, and I hope that wherever you are, this media gets it to all over the world, and we are happy to pass it on to people and let them learn to do these things. So thank you very much for watching, and I'm going to sign out.